Have you ever experienced hot flashes, tingling, insomnia, sweated more than usual, and noticed your memory failing? Yes, all of these can be symptoms of menopause, the topic of today's video. 4 out of 5 women in the peak of their age complain about unwanted symptoms, so it's extremely important that you learn more about this transformation in the female body. If you're bothered by menopausal symptoms, be cautious. I'll divide this video into 2 parts. In the first part, I'll talk about menopause and its 10 most common symptoms. In the second part, I'll discuss the 5 things no one told you about menopause, and most importantly, I'll provide tips on how to go through this phase with the highest possible quality of life. Stay until the end. But before that, like the video, as the more people who like it, the more YouTube will distribute it to those who don't have access to doctors or hospitals who need this knowledge, and also share the video with your friends and family. Menopause occurs when the ovaries stop producing the female hormones estrogen and progesterone, marking the end of a woman's fertile period. Some women look forward to menopause, finding menstruation inconvenient and going through it without issues. Others suffer greatly, considering it a horror, a nightmare. It presents very severe symptoms. Menopause can significantly interfere with a woman's daily life. When does menopause occur? It usually happens between the ages of 45 and 55. It can happen prematurely due to genetic reasons, surgery, medications, radiation therapy, chemotherapy, or autoimmune diseases. When it occurs before the age of 40, it's called early menopause. What happens in menopause? During menopause, female hormones decrease suddenly, leading to the many symptoms many women experience. There's an increase in FSH from the pituitary gland and a decrease in estradiol, the primary and most effective estrogen produced by women. But if you look closely, estradiol has been decreasing for some years, and the tide has started to rise with it. This is the phase we call climax. It means your ovaries begin to fail long before the last menstruation. That's why female hormones decrease. So let's be clear, menopause is the date of a woman's last menstruation. But you have to wait a year to be sure that day was really your menopause day. If your menstruation occurred 6 months later and you haven't had any since, menopause will be the date of your last menstruation. Oh, but I still menstruate and have many symptoms. This is the peak. You have fewer hormones than before, even if you haven't entered menopause yet. Surprisingly, this peak can last between 2 and 10 years. It can cause many physical and psychological symptoms. What are the 10 classic signs and symptoms of menopause? The first symptom, bleeding changes in a woman starting to have an irregular menstrual cycle. Periods may become shorter or bleeding may be more abundant. She may bleed more or bleed for several days, leading to anemia, as if she had a bleeding disorder. The second symptom, the woman begins to complain about hair changes. Hair becomes more brittle and dry. Women complain that they're losing volume. Once full, their hair has now significantly reduced. In addition to hair not growing as much, there's a decrease in hair length. Of course, hair loss can also occur. The third symptom, the woman notices changes in the skin. This happens because as hormones decrease, a woman's skin may become drier, thinner, and saggy. Collagen breaks down more easily, so women start to see wrinkles where there were none, and the skin loses its natural elasticity, becoming saggy and less firm. The fourth symptom is nail changes. In menopause, nails don't grow as much and become more brittle, losing their natural shine. They can also have those fine lines, longitudinal lines. Symptom 5, hot flashes, sudden waves of heat, coming from below and rising to the head, and can last from a few seconds to a few minutes. This is one of the most bothersome symptoms for women. Sixth symptom, weight gain. The woman starts gaining fat, especially in the arms and abdomen. Metabolism slows down, there are changes in body composition, loss of muscle mass, lifestyle changes. Active women may be more in shape, which helps increase fat and reduce muscle mass. Seventh symptom, night sweats. The woman starts to experience excessive sweating episodes during sleep, which can be accompanied by hot flashes. This is very uncomfortable. Sweating can be so intense that you need to change the bed linen. This is due to hormonal fluctuations, vasodilation, brain changes, especially in the hypothalamus, and even emotional factors. Eighth symptom, mood swings. The woman becomes more anxious, gets angry about anything, and can also become depressed. Not only due to hormonal changes but also due to an imbalance of neurotransmitters in the brain. Serotonin, which controls mood, sleep, and appetite, may decrease, as well as norepinephrine, related to attention and concentration, hence the difficulty in concentration during menopause. Not to mention the decrease in dopamine, which leaves you excited, with decreased libido, and a decrease in GABA, which gives that calm and relaxation feeling. So, if you're experiencing major mood swings, it's due to this combination of factors. Ninth symptom, vaginal dryness. Many women complain of vaginal dryness during menopause. This is because estrogen stimulates the glands that secrete lubrication in the vagina. Additionally, there's a decrease in local blood circulation and a decrease in flexibility and muscle tone. This can interfere a lot in a woman's life, especially during sexual intercourse, as the woman loses this lubrication even when aroused. It's a physical problem and has nothing to do with whether your partner likes it or not. To worsen the situation, the skin as a whole becomes thinner and more sensitive, pain during sex and dyspareunia increase. This can further worsen female sexual desire. Symptom 10, fatigue and muscle pain. Mainly due to hormonal factors, deterioration of sleep quality, and psychological and social factors, many women complain of constant fatigue, lack of energy, and muscle pain or muscle sensitivity, which can affect the quality of life. These are the classic symptoms of menopause. Of course, there may be other symptoms. Other menopausal symptoms such as heart palpitations, tingling in the hands or extremities, dizziness, tooth sensitivity, dry eyes, memory loss, burning in the mouth or tongue, breast pain, and even changes in body odor and even in urine smell. Menopause is a very delicate time for many women. And look, menopause doesn't just cause symptoms. There are real changes in a woman's body. Here I will talk about the 5 things no one told you about menopause. First, you should take care of your heart more than any other part of your body. See, most women are very afraid of breast cancer. For a good reason, of course. It's the most common cancer. But what is the disease that kills most women? Cardiovascular diseases. It's not cancer. Estrogen protects women from heart problems. It's true that if you go to a cardiac emergency room, who in the 40s and 50s will have a heart attack? Men. It was mainly men who had a heart attack in this decade. But after menopause, things change. Bad cholesterol (LDL) starts to rise, as do triglycerides, with good cholesterol, which protects women, and HDL tends to decrease. Not only that, a woman who never had high blood pressure before starts to feel high blood pressure and relapse into high blood pressure. All of this increases the risk of fat plaque formation and also the risk of plaque rupture, leading to a heart attack if it's in the coronary arteries, or a stroke. The second thing no one tells you, menopause increases the risk of dementia. Women are more likely to develop Alzheimer's disease. It's twice as common as in men. Menopause is one of the main culprits. After analyzing the symptoms I mentioned, you realize that menopause greatly affects women's brains. Hot flashes, sweating, anxiety, depression, these are neurological changes. Why is the female brain modified with menopause? Estradiol helps in the brain's energy. Women have estrogen receptors. Estradiol acts specifically on the hypothalamus, which regulates body temperature. So hot flashes are the hypothalamus out of service. Memory lapses and forgetfulness are the fault of the hippocampus, the center of memory, which also has less energy. Menopause also interferes with the brainstem, causing a deterioration in a woman's sleep quality. She also has difficulty falling asleep and may wake up more at night, and the amygdala also makes the woman more anxious and with all those mood changes. brain energy can decrease by up to 30% after menopause, leading to a decrease in gray and white matter volume and glucose metabolism. But is there a way to improve this? There's a way, I'll talk about it at the end. Wait! The third thing no one tells you about menopause is that it increases the risk of osteoporosis. Estrogen helps regulate bone formation and resorption. As estrogen decreases, there's increased bone resorption and reduced bone formation, making bones more fragile, increasing the risk of osteoporosis and later osteoporosis and fractures. The fourth thing no one tells you about menopause, it increases the risk of infections. There's a decline in immunity in menopause, making women more susceptible to infections, especially urinary tract infections. This is the sum of factors. There's vaginal atrophy, changes in microflora and vaginal flora, a decrease in the number of lactobacilli that protect the vaginal flora, making it more susceptible to bacterial infections such as E. coli, which increases urinary tract infections, as well as vaginal infections and discharge from fungal infections, candida, as well as bacterial vaginosis, especially Gardnerella, which is a white and odorless discharge, and Gardnerella is a yellow and foul-smelling discharge resembling spoiled fish. And the fifth thing no one told you, it changes the whole metabolism. I've already mentioned that it changes body composition, reducing muscle mass, increasing fat, and altering fat storage, putting it mainly in the abdomen. This leads to a slowing down of basal metabolism. Your body will need more movement to burn the same amount of calories as before, not to mention the increased risk of developing type 2 diabetes due to insulin resistance that occurs in menopause. Just bad news? Is there a way to improve? How can you have a better quality of life during menopause? How to be that dynamic woman you used to be, or better yet, how to have an improved version. Let's move on to the 5 tips. One of the most important, you have to exercise. What to do if your brain power decreases? You have to exercise to increase brain circulation and give more oxygen so that your brain becomes more active. It's very important that women exercise during menopause and menopause. Any exercise is important: walking, cycling, dancing. Do something you love and can sustain. Physical exercise prevents dementia, so you won't have brain atrophy anymore. It improves cardiovascular health and strengthens bones, especially if you engage in weight training, improves sleep quality, helps mental health, and increases neurotransmitters that are normally lower in menopause. Physical exercise is a step you can't skip. You can't put it off. Want to have a better life in menopause and menopause? You can control it. Fourth tip, eat well. There are some foods considered beneficial for women's health during this period. The first, calcium-rich foods that help strengthen bones. Then milk and its derivatives such as skimmed cheeses and yogurts, but if you suffer from lactose intolerance, vegetables like broccoli, cabbage, and Oroponobis can be used. Another important food group is fiber-rich foods, so whole grains, legumes, fruits, and vegetables help promote a feeling of fullness, improve digestion, and help with weight control, not to mention the improvement of skin and hair. Let's not forget healthy fats like those found in olive oil, avocado, nuts, and seeds. The Mediterranean diet, in addition to improving the brain to prevent dementia, has a study with over 6,000 women showing that it can reduce night sweats and hot flashes that bother women so much. Oh, and we can't forget to mention the importance of foods rich in phytoestrogens. Phytoestrogens are plant compounds that have a structure similar to estrogens. It can help alleviate some unpleasant menopausal symptoms. The main food is soy, but if it never enters your home, other sources are flaxseed, chickpeas, and lentils. A drink that helps some women when they report improvement in some menopausal symptoms is mulberry leaf tea. Also due to phytoestrogens as well as the antioxidant and anti-inflammatory effect. And of course, avoid some triggering foods, hot and spicy foods, sweets, coffee, caffeine, tea, and alcohol that can worsen menopausal symptoms. Third tip, take time for yourself. I don't know a woman who wouldn't want to help everyone, who wouldn't give everything to her children, who wouldn't divide herself into 1,000. But menopause can be a tough time. We know that stress can worsen many menopausal symptoms. In menopause, you need to pay more attention to yourself. And take time for yourself to do fun things, even if it's just having a cup of tea just for you. If necessary, consider getting specialized support such as a psychologist or psychiatrist. And do everything to sleep well. What helps a lot? Tip 2. How's your blood pressure? How's your glucose? How are your cholesterol and triglyceride levels? All of this is very important. As I said before, cardiovascular diseases are the ones that kill most women. Look for a cardiologist when entering adulthood, especially if you have a family history of heart attacks, angina, or sudden death. Not just a gynecologist. A cardiologist is also important. The first piece of advice: do hormones come from hormones? Is hormone replacement therapy worthwhile? It depends. This is not a simple answer. Hormone replacement therapy has been a controversial topic since the WHI study, the largest to date, was released in 2002. The study showed that it increases the risks of heart attack, breast cancer, thrombosis, pulmonary embolism, stroke, and dementia. Really, for this group, hormone replacement is terrible. The first point of HRT must be well observed. Not for everyone. On the other hand, a woman who has many symptoms, is at low risk for blood clots, has a low risk of cancer, doesn't smoke, and doesn't have high blood pressure, HRT may well be indicated. It can improve symptoms, hot flashes, night sweats, mood, and reduce the risk of osteoporosis and even the risk of cardiovascular diseases. You should talk to your doctor. It is he who will indicate whether or not to use hormones. And for how long? It can be 6 months, a year, 2 years, or 5 years at most. It's better not to exceed. And always have regular checkups with your gynecologist to know whether to continue or stop treatment. That's it. I hope you go through menopause without any problems. I hope you enjoyed the video. Until the next video. Thank you very much.